This is the Optimal Wellness Podcast, helping you achieve optimal wellness naturally, with your host, Dr. Clifford Fetters of Health and Wellness of Carmel.
Hello, everyone, and welcome back. This month, we are talking to you all about women's health. My name is Cassidy Waters, as always, here with
Dr. Clifford Fetters.
And we are really excited. This is something that our listeners have wanted for a long time, especially our female listeners, obviously. So women's health, there's a lot to break down. I think the big three topics are breast cancer, hormones, and menopause. So let's go ahead and just get into the female hormones and what that looks like. So what are the basics of like female hormone issues that we hear the most about?
Yeah. Well, at a young age, obviously PMS.
Yeah.
You know, girls, before they have their period, they can have severe irritability, and that's all from hormone changes, from going from no hormones to too many hormones. PCOS, which you know about, and that can be devastating as far as how you feel, and the weight gain can be devastating, as well as the mood changes. I would say fibrocystic breast. Women have so many issues with their breast, and it's all related to hormones. Endometriosis, that's one thing traditional medicine really doesn't address, the hormone issues of endometriosis. And then obviously breast cancer, ovarian cancer. I believe that all these cancers are primarily related, not just to toxins, but actually hormone imbalances.
Oh, wow. Okay. Yeah. And I think because of our cycle, there's so many times where, my friends who've had endometriosis or Crohn's or anything related, like it's like, oh, you're just having really bad menstrual cramps. And it's like, no, the situation can actually be much worse. So as far as in just the hormone treatment, what does that look like if you're going holistic or traditional?
Yeah. So when I started in practice, many years ago in 1988, we learned all about hormones in medical school and in residency. And then I had for my first patient in menopause. I was so excited. So I went to my preceptor. It's like, I never thought about they never taught me the treatment. We knew everything about hormones. And I said, well, how do you know if they're estrogen dominant or progesterone dominant? And he just looks at me like, you just give birth control pills. And I go, that makes no sense. He goes, that's what we do. So I said, well, how do you know if they're estrogen or progesterone dominant? He goes, well, you give them the high estrogen version. If they feel worse, then you give them the progesterone version. And I go, boy, that's really scientific.
Yeah.
So finally, there was literally a physician trained in Africa. And I figured, I let me talk to him. He knew everything about the treatment. He told me the book to read. And Dr. Lee, very famous, the first one that really talked about hormones. And so we did... in residency, we were doing blood tests, but they wouldn't get paid for it. And then in practice, they still wouldn't pay for blood tests. And luckily, I had a patient that was politically connected. And she said, Dr. Ferris, you have power. I go, I do? She goes, yes. It's like, so she helped me write this letter. So every patient that had a denial, they sent this letter to their insurance company. And within 2 months, all the insurance companies in India were paying for hormones.
Oh my gosh.
Yeah, so I realized I did have a little power. It's pretty cool. Yeah, so we just do, in holistic health, we do hormone levels. Yeah. And the estrogen, progesterone, testosterone, sex hormone binding globulin. Some people are just born without enough sex hormone binding globulin. So they're so fragile that if you don't have, your body's so smart, it has this protein that if your hormones go up or down, it can bind it and control it. But if you're born with not a very high level, you just have to be very strict as far as how you control your hormones.
Yeah. And I think something that is the one thing that's been really great about the internet is women are talking so much more about their hormones and the cycle, right? So you do have 4 phases of your cycle, and understanding as your hormones drop each time of the month, or, because there are 4 different parts. So it's like there's things that rise, things that fall. And the more you understand that, I know, as I have PCOS, and I remember the first time I saw you, which was 4 years ago, if you can believe it, I remember we talked all about this, and I was like, I've had this since I was 13, and no one has ever mentioned this to me before. They just say hormones, but they don't actually go into detail. So I think that's what's been awesome about holistic medicine is they kind of teach you how to feel empowered and to take control of what's going on, because you can actually understand like, oh, my progesterone is lowering, so that's why I feel this way, and these are the ways I should exercise, and I should eat more fat, or whatever it is. But I always have thought that was really interesting about, because again, the traditional way usually is, here's some birth control, hope you feel better.
Yeah. I think the take-home message is if a woman has symptoms related to their hormones and their cycle or their breast, that's a sign of a problem.
Yeah.
And it's not normal. Bad menstrual cramps is not normal. Cyst in your breast, painful breast is not normal. Having headaches at that right before your menstrual cycle when your estrogen drops is not normal.
Yeah.
So I love hormones because it's really simple.
Yeah.
There's just 3 hormones, and you can check the levels, and based on the symptoms, you can determine what's the issue. So having any of those symptoms is not normal.
Yeah. And on top of that, so you come in, you get tested, but you should probably get tested often for your hormones, right? Because those can change. Or how often do you think you should be testing
if women
for those?
women have no symptoms, normal cycle, and remember that in med school they teach us it's rare to have a perfect cycle the exact same day. So it's normal to be off and on. And guess what? Stress changes your cycle more than anything else. But if women are having symptoms, then that's the time I do it. For younger women, if it's menopause symptoms like hot flashes, vaginal dryness, which I've seen women in their 20s with premature menopause.
Oh, wow.
Those I check levels. But most of the women, if you've done this enough, you just know the imbalance and how they need to change their diet. And if it's pre-menstrual headaches, we know it's low estrogen, and a lot of times I can just give them a little bit of estrogen.
Okay.
As long as they're doing everything else right.
Yeah.
But if they're out of balance, it really helps people say, look, your estrogen is 1,000, and it should be never more than, in my opinion, around 300 for most women. And okay, there's things that motivates them to do what I want them to do.
Yeah. So would that be considered, this is a buzzword too, hormone replacement therapy? Is that
right? So usually when you say hormone replacement therapy, you're talking about menopause.
Okay.
But we do hormones a lot. And most women are actually, they are estrogen dominant, not enough progesterone. So if you're not sleeping and you have anxiety, progesterone is the natural Xanax for women.
Right.
So if you have a low progesterone, you can really feel anxious and tense and retain fluid. And progesterone is a very, very important hormone. There is a really cool test that we can check the whole breakdown products of estrogen. It's called the good, bad, and ugly. Mm-hmm. If you have too much ugly, that really increases your risk of cancer. But so what's the problem? You're not methylating, you're not breaking it down. Mm-hmm. So all my patients, I say, well, that test is pretty expensive. Spend your money on taking the vitamins to get your liver working, detoxify your liver, and make sure no metals or toxins in your body. And when you do all those things, so the cycle goes back to normal, the hormones go back to normal, and the metabolism of the hormones. But definitely, if there's a concern or in menopause, every woman periodically should have the estrogen metabolism ratios obtained so they can determine the cancer risk from that. Okay.
So menopause, all these women have, like you said, hot flashes, all these symptoms. Is that normal? Like if you were talking just regular menopause, is that supposed to happen, or are there things that you could do just to eliminate that?
Right. The super, super healthy women, the Miss Organic, and they have the ideal body weight, the transition from premenopause, perimenopause to menopause is very gradual. Okay. Like in some Polynesian nations, there's no word for menopause or acne, because they have such pure diets and pure lifestyle and activity that it's such an easy transition. They don't even discuss it.
Oh, wow.
But in America, in most Western nations, it's we have so many things going on that it's often an issue.
Yeah. Well, I think that's a really good thing to touch on, because I think so many people have hot flashes, so many women, they think it's normal, but it's not. And you should probably try to get some sort of treatment to relieve that, because I've heard they're absolutely awful.
Right. And that people don't understand. It's like hormone replacement therapy, when done right, does not increase your risk of breast cancer.
Okay.
If you use the synthetic hormones, which in the holistic world, we knew that was an issue. There was something called the Women's Health Initiative that came out about 22 years ago, that the headlines were hormone replacement therapy causes cancer. And so traditional doctors had everyone just abruptly stop their hormones. Mm-hmm. And that's when they all came to me. And it's like, no, that's not acceptable. But we've known forever synthetic progesterone, medroxyprogesterone, is Provera, causes cancer.
Oh, okay.
So if you read the fine print in the whole study, Premarin, which is actually it's horse hormones, but it is natural, even though it's not natural for a woman, actually decreased risk of breast cancer, decreased risk of colon cancer. So now if you use bioidentical hormones in a low amount, and you have them all balanced, we feel, no one, you'll feel the best ever. Because these poor women, to have a baby, you guys go through hormone cycling every month for most of your life. And so when women have balance, in the 50s, my patients say, that's the best I've ever felt in my life, because they have steady state of the 3 important hormones. And people don't realize estrogen is critical for your brain. There is research that it does help slow down Alzheimer's, definitely treats osteoporosis, and just anti-aging. Women, vaginal atrophy, incontinence, your skin. You want to have beautiful skin when you lose the estrogen. And don't forget, estrogen makes women kind and able to handle their husbands. Our testosterone makes us mean and aggressive, and your estrogen makes you love. But guess what? After menopause, twice as many women initiate divorce as men, and we totally feel it's from that. And psychologists, our marriage counselors send clients to me and the woman, and I get them on hormones, and then she agrees to take her husband back. But you ain't got no estrogen, you're not going to put up with the average man. So it's so important for your relationship with other people that the estrogen just makes you calm and relaxed, and just we think it's more love and compassion. But when it's low, you don't feel love.
Well, and I think it's so tricky because, and I think so many women are like, oh, it's just me getting older, it's just this, and it's really sad because we do go through a lot. Every month we go through all these different hormone changes, and then you have babies, and I had 2 back to back, and it was like a roller coaster. But and then you just think everything is normal, but really, if you just listen to your body and you make sure you get your hormones tested, that can really change everything about your life if everything is balanced. So
for sure, a lot of postpartum depression. It's actually a lot of it is the hormones, which affects the neurochemicals too of your brain, particularly the serotonin.
And again, it's not. I had terrible postpartum depression and anxiety, and it's not normal. Just because a lot of people have it doesn't make it normal. So as far as the arc from obviously starting your period through to perimenopause, menopause, what are like the normal ages? What does that arc look like?
Sure. The average woman goes into menopause at age 53.
Okay.
Perimenopause starts 10 years before that, on average. Well, I said I have women in their late 20s that can start having early menopause, and obviously there's something going on physiologically with their body, and the sooner they address it, the sooner we can protect ovaries and let them maintain their fertility.
What specific symptoms are you looking for if you're doing a hormone test?
Sure. Definitely symptoms: PMS, mood changes, breast tenderness, abnormal menstrual cycle, pain, cramps, hot flashes, all those things.
Okay. And as far as supplementation, we didn't talk too much about that. I know there were ones you put me on when I first started.
Right.
Are there any ones specific to hormones that you've seen have really helped?
Probably the biggest game changer is that scientists figured out over 20 years ago that there are bacteria in women's gut that can produce something called glucuronidase that makes you reabsorb estrogen. So I'd say the vast majority of my patients with fibrocystic breast and symptoms of excessive estrogen just keep reabsorbing the estrogen.
Oh, wow.
And a company, I only know one company, is called probiotics. And you take it for 2 months, and literally this is like a probiotic, and a phage is something that only kills one specific organism. So they found the bacteria that will kill the germs that produce this enzyme.
Oh, wow.
And when you kill those germs, you stop absorbing estrogen. That alone is huge. And there's something called aromatase inhibitors that keeps your body from making estrogen, and that's very popular. So and then max estrogen receptor detox is what we use to get the excessive estrogen from the breast. Mm-hmm. So fibrocystic breast, within 2 months, the pain is gone. Because my concern, if you have painful fibrocystic breast, you're definitely at increased risk for breast cancer. So you need to take care of it when you're having the pain and the cyst, and not wait until it's cancer. So that's probably the biggest game changer I have, is just getting the estrogen out of the body and keep people from absorbing the estrogen, and not putting more phytoestrogens in their body. So pesticides, unfortunately for women, these plastics, all these phytoestrogens, so these chemicals can stimulate your receptors, and they act like estrogen, which causes all this estrogen dominance in female cancers. And that's the reason why women is so important. I talk about alcohol. If you drink more than 1 drink a day, you increase risk of breast cancer. Some studies say now that even 1 alcoholic drink a day just women already has a compromised immune system, and that can tip the scale towards breast cancer.
I feel like breast cancer is one of the most prevalent cancers. Like, what is the ratio of breast cancer here in America?
Right. So women today, there's a 13% or 1 in 8 chance of having breast cancer in your lifetime.
Yeah.
And the concern is it's been going up dramatically, particularly in young women. Even under 18, we're seeing a big rise.
Yeah. Yeah, so getting those screenings as far as a mammogram or a thermography are really important.
Correct. And doing a breast exam. You know, a lot of doctors aren't teaching that because the problem is there's so many false positives, and the biopsies actually cause more harm than good. But in the holistic world that we don't do biopsies, there's so many other ways we can test, including the OncoDeclare. I recently had a 21-year-old who had a positive OncoDeclare. Oh, wow. But she had fibrocystic breast and other issues which will be addressed.
Yeah. Well, and I know I have a great primary care doctor, and she always told me to know your lumps. Like, it's normal for your breasts to be lumpy, but just keep an eye on them and make sure they don't get extra hard, would you say that's probably,
Absolutely.
So you're not freaking out every time you feel something?
And women say, I don't check because I'm so lumpy. And I say, well, you need to come in, have an exam from your doctor, and they can explain it to you. And your brain is a supercomputer, whether you know it or not. I have so many times women come in and say, I don't know what's different. It just feels, my brain's telling me it's different. And I've had women, cancer like 3 millimeters. But her brain told her there was something different. So even if you feel like you're going through the motions, you will notice. And some breast cancer rapidly growing, you feel this hard rock. I mean, if you feel something really hard, something's different than normal, then you need to see your doctor.
Yeah. And you mentioned to me in passing about just how important it is for women to get exams and specifically pap smears, right?
Right, because that's the same thing. That it's now once every 3 years you see your doctor for your pap smear. Once a year, every person should have a physical. Yeah. And if you're there, you might as well do the pap smear. Yeah. And the exam I've only diagnosed 2 ovarian cancers at an early stage, but 2 women are alive because I felt the ovarian mass and they were operated on before it spread. Yeah. And there's only 5,000 to 8,000 cases of vaginal cancer every year. But if you're one of those 8,000 women, you're glad it was caught early. Yeah. Rectal cancer, Farrah Fawcett. How did she die of rectal cancer if it should be caught so easily? Yeah. But you just have to, just like your car. If you don't take your car in once a year to the mechanic, you're looking for trouble. Yeah. Because you don't know if your suspension or your brakes, and you only need it when there's an accident you need to avoid. Yeah. But when things go bad, it's like, okay, you did harm to yourself by not doing that. Yeah. Yearly checkup. So everyone should see their doctor. Even we see well baby checks, but even at 18, we start doing physicals once a year. Yeah. And I think I was just gonna say that. I'm like, if you have to go to the BMV or the dentist, like, you can sit through a pap smear once a year, and it might save your life. So. Yeah. Well, great. Well, thank you guys so much for listening. We do have a promo on supplements this month for women. The code is women15, and you get 15% off our women wellness supplements. And those will be listed down in the comments below. Thank you guys so much for listening. We'll see you next time.
Thank you for listening to the Optimal Wellness Podcast. Subscribe now to get monthly episodes to help you achieve your wellness goals. And if you'd like to learn how we can help, schedule an appointment at Health and Wellness of Carmel today. Just go to hwofc.com or call 317-663-7123.